I sat on the physical therapy section of the collaborative, and our main goal was early mobilization as well as outcome measures. As a direct result of this collaborative and the direction of our orthopedic provider, Dr. Grace, we've established post-op day one early mobilization protocols. It's just best practice for us. It's not something that we track, it just is what we do now. And we're starting to see decreased in length of stay and increased discharges to home versus skilled nursing facilities for our patients.
To see that multimodal pain management is supported by the participants in the collaborative gave me more credibility when I showed physicians data on how their patients did. We started out with Dr. Grace leading the way with multimodal pain management, and now with him and sharing data, the other surgeons are more inclined to use that tool.
We had this TKA collaborative, as well as a perioperative surgical home, as well as some work going on with transitions of care of patients outside of the hospital. Instead of working in 3 different silos on those initiatives, to look where there are opportunities and there's cross-utilization of those changes and those improvements, each of those initiatives is able to move forward quicker. We were looking at some data that was showing on average patients were staying around 21 days in the nursing home, and through the work in collaboration, we were able to work with these facilities and reduce that down to about 12, 13 days. We're better utilizing our resources and I think are making improvements much quicker.
Being in the collaborative has increased our improvement stratification from the standpoint we're held accountable as a member of the team. Being part of that team and the designation of having our data out there has really kind of pushed us to develop that process much more streamlined than we have in the past.
From an administrative standpoint, it has definitely made us more cohesive as a group within our service line. I also think that it's been very helpful in being able to share that information, the work that's going on with the collaborative, with the physicians, and it's a lot easier for them then to take the message back to their team of physicians when they know that other systems around the state are doing these things. And so when you have that data to be able to share with them, it does make the change move quicker.
And I reached out to one regarding a clinical practice guideline, and it's nice to have those connections out there. Whereas if you're not in any type of collaborative, you're reaching out without any kind of pre-established relationship. So it helps to have those.
And when we have different ideas or different initiatives that we're thinking about embarking on, I've got a list of contacts that I can reach out to that might say, hey, we did this, we tried this, or here might be something that you might want to consider. Everybody within the collaborative is really on the same page with regard to being willing to share their information and don't see it as really a competitive threat. It says to me that they really all are about health.
So one of the things that we faced is we were doing an awful lot of improvement work within data care. When it's just 1 or 2 surgeons and a few administrators, and they're trying to change things and go in a very different direction, it makes it difficult for us to execute it and actually sustain for the long term. By having AboutHealth and learning that we weren't off base, that we were heading in the right direction, it allowed us to accelerate and it allowed us to have more confidence, especially for our surgeon champions, to know that we're not out there alone. Some of the things that we worked on were early mobility. That's something we had started working on, but again, by having reinforcement based on other systems working on those types of things, that accelerate our progress. So I think the intent of AboutHealth is to economies of scale and learn from each other and to continue to improve our care for our patients. If it's done and it keeps on moving in that direction, we can actually make some wins.
We really wanted to look at our length of stay. Our length of stay, although it's low, was still higher than some of the other AboutHealth collaborative groups. And what we did was we took that information back, we went to the surgeons, we went to the unit staff, the clinic staff, and anesthesia. We decided to look at what anesthesia are we providing to our patients and how can we change that so that we're better able to mobilize our patients on day 0 rather than waiting until day 1. Since we've done this and we've worked with anesthesia to change the anesthesia we've provided, we have seen a significant decrease in our length of stay, and our patients are happier because they're leaving the hospital sooner. So I would say we were making improvements, but what AboutHealth did, they have these monthly phone calls, and at first, to be honest, I really didn't want to do the phone calls because it was holding me accountable for the work and holding the team accountable. But now, when I really look back, I say every month when we have those phone calls, I am proud to be on that phone or have staff on the phone to say the work that we've done over the last 4 weeks, and to compare that with the work that the other AboutHealth groups have done. And the phone calls are important because at every one of them we get more ideas on what we can do to improve.
Working with the other systems and the AboutHealth has really kind of helped us to set goals and somewhat be competitive with one another on where we are at and hold us accountable to getting things done. Being a member of AboutHealth and getting involved in the collaboratives and working with others who are doing the same thing definitely helps to accelerate quality improvement.
I think it's given us a platform to kind of share the standardization that we've done to look at our process before patients go to surgery, when they're in the hospital, looking at lowering our length of stay, and then looking at our follow-up care, just where can we improve in our whole process. It's been nice for us to kind of try to help other facilities who don't have an integrated system like we do. You know, what are things they can control with their patient population, you know, the standardized education that we give. So just sharing that, I think, is good.
Well, the quality work that's gone on in AboutHealth has very much complemented the work that we do at Bella, particularly in my area, which is surgery and perioperative medicine, and has not only complemented but has accelerated. So our question was, how does this work connect with AboutHealth? Two of the big topics that AboutHealth chose to participate in or work on were total knee replacement and the back pain project. Both of these areas were areas that we independently, through a process of our own analysis, had decided were top priorities for us in the preoperative surgical home. Interestingly, the set of recommendations that came out, or the goals that were set in AboutHealth, were almost verbatim the goals that we were working on. So, for example, when we went to our neurosurgeons to discuss with them, they had charted a new way to prepare patients and optimize them for better outcomes in the preoperative phase of surgery. And we needed our neurosurgeons to trust us in giving us the patients without scheduling surgery to allow us enough time to do our work. And I think when we went to them, they were very receptive, and part of that that had come from their participation in the AboutHealth Collaborative, because they were hearing the same things coming out of our mouth as they were hearing when they went to these collaboratives.
To learn more about collaboratives and what they mean for you, visit AboutHealth.com.